welcome. Can you hear me okay? My husband says I have no problem being loud, so if you can't hear me in the back, just let me know.
The rallying troops.
Everybody on their seats. So welcome, welcome, welcome. First off, I want to say thank you for, I know how busy you guys are. I know that your world pulls you in about a million different directions. And the fact that you took a few days of your busy schedule to spend it with us here in Knoxville means the world to us at our very first prevention conference. So thank you for joining us. But yeah, so I always want to make sure you know how grateful that we are that you took the time to be here. And then we are very grateful for you to spend an hour or so with us in here. Like we were talking earlier, we're like, I wonder if anybody's going to come. I wonder if anybody's going to come. And apparently some of y'all think we're worth coming for. So thank you for that. My name is Jill Murphy. I am the FFPSA. I'm going to stop myself there. Yeah. We, like you guys, are used to alphabet soup. How many of y'all use all these acronyms, initials, letters all the time? And I'll have dinner with my husband and I'll throw out these. He's like, I have no idea what you're talking about. Many times. I'm like, okay, so we are going to be very intentional and conscious today to not use a bunch of initials. And if we do, they have been warned that I'm going to stop them and say, tell everybody what that means. Okay? So if I miss it, Liz White, I'm looking at you. I need y'all to say, I do not know what you said. I get that a lot. So just let us know. Please, please, please. So my name is Jill Murphy, and I'm the FFPSA, which I said I'd tell you what that was, Families First Prevention Service Act. And I passed in 2018 that Tracy's going to talk a little bit more about. And we are prevention consultants, which what we do, we're going to talk a little bit more about. Tracy's going to do that after our introductions. But I serve the current East Region, past East Region, current East Region. Everybody knows DCS had a little restructure. Everybody's going, yes, 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 we did. So I'm like one of the few lucky ones that my name didn't change. So I'm very excited. So before we get started, I want to introduce my team to you. And I'm going to start. So some of my friends are on panels, some are sitting in the audience, but you're going to hear from them anyway.
Okay, I'm Jill Preston, and I have 11 counties between Midwest and West. I'm on Lake Forman. I have what was under Cumberland, so Ventress in the east, and then Tennessee Valley Cluster 1, and then 4 of the counties in mid-state.
Hi, I'm Stacey Burlock, and I serve the Knox County region.
I'm Charlotte Olin, and I cover what used to be South Central, so now I have 7 in Midwest, 5 in Mid-State, and 2 in Tennessee Valley.
I'm Caitlin Bowers. I'm the FFPSA Prevention Consultant for Northeast Tennessee.
I'm Catherine Barber. I go by Kat, and I was covering Smoky, and I now cover the lower Northeast.
Kristen Bohanna, and I cover 4 counties in the east and 5 counties in Tennessee Valley.
Hi, I'm Christina Astroline. I'm in Mid-State, or mostly just Davidson County.
Hi, I'm Stephanie Ellis. I cover the Shelby County region in the West.
I'm Edna Black. I cover 13 counties in West and Midwest.
Hello, I'm Vanessa Moore, and I cover the old Cumberland region.
Good afternoon. I'm Tracy Cochran, and I get to lead all of this wonderful team of consultants that work across our state. So I'm very proud of all of them over the last, 15 months that we've been in this. So just to talk a little bit about what our program is and what we are working with in partnership with DCS to work on. So we all know FFPSA, Families First legislation passed in 2018. So states developed implementation plans of how they were going to roll out prevention, the things that they were going to do. And part of the effort that Department of Children's Services took on as part of that work was to consult and work with UT Schwartz. So if some of you went yesterday and had the opportunity to listen in to our implementation side of things, Siobhan shared our landscape assessment for Tennessee. So that was part of the work that Schwartz has been doing over the last few months.
And Schwartz stands for,
Oh my gosh. Social work office and research and public service.
it has taken us 15 months to get that down, to the record.
It's about like, I was like, can we have a longer title, FFPSA Regional Prevention Consultant, like we have the longest title for a job. So, but anyway, so we partner with that side and a lot of our work as well, and we'll talk about that a little bit as we go through this discussion today. But part of the task that this team is charged with is really that work and direct interface with DCS frontline professionals. So whether it is the workers who are out in the field that are working with the families and having that direct touch with families, or if it's their supervisors to provide support in that capacity, we're doing that piece of the work on our side with the prevention team. So we work in that space. We also work just to help, and as we do that, I would say we're working to build capacity within DCS. So one of the things that we had learned, or that the agency, and I'll go back and say this, our team largely came from DCS. So we have a lot of experience working within the system. So we understand where some of those challenges lie within the regions that we serve. But part of what we knew going in is that there's challenges when you're in that frontline work. It's difficult because you're meeting families, you're out doing the work, you're trying to connect them to services, and you don't really have time to go out and really understand everything that's in the community, every service that's out there. So we have been able to kind of step into that space in terms of preventing or changing the culture within DCS to start to look at a more prevention-focused framework on how we interact with children and families. So this team works alongside DCS in that capacity. We step in, we have had the opportunity, all of them have, to really get out and learn what resources are out there in those communities and those counties that you're serving in. What does that look like? They network, they attend meetings, and then we're doing direct coaching consultation with frontline professionals, with supervisors, just to talk through like, what are some steps that we can take? Let's slow down and think about this history of the family. Let's think about all the services that are out there that are in the community, and what can we put in place to prevent, and how do we maintain children safely in their homes, or within, if we can't do that, if they can't stay with the parent for whatever reason, but can we maintain them if we can? Let's really be thoughtful about that. So the consultants have been able to kind of take in that role to do some of that direct work and that direct coaching and collaboration with DCS to help start to reshape that landscape. That's a big shift to turn. We all know that. Like, it's not an easy task in any of the roles that any of us take on. That's a difficult shift to turn. So we're making progress every day as we're working in regions. We started with minimal direction of here's where we're going to go. And I think you'll hear today, as they share just about the work that they've done in their regions, you will see that like every consultant has had to navigate how do we do this work within that space, within the region and the counties that they serve. It looks different for every single one of them. There's no cookie cutter way to approach the work that we've been doing over time. The last kind of piece of the work that we do is around training and education for Not just with Department of Children's Services and frontline staff, but we're also looking at if we have space to do, training or education sessions within the court, if we're partnering with providers, if we're going in and working with school systems. How can we start to bridge those gaps, and how do we build a collaboration? Like, we can't do this in isolation. DCS can't do it in isolation. They can't do it by themselves. They have to have all of you who are sitting out in the room. They need all of you to do this work. You also can't do it by yourself. I bet a lot of us this week have learned about, we saw it in the networking that we just did with Jeff, like, Rob Burke and I were talking, like, some of these ideas we have these in Tennessee, like, they're out here right now. So there's things that we don't always know about. And how do we build a cross system of collaboration within the state for prevention? And that's really where we are trying to get with the work that we are doing. So we're very excited about that. I tell my team, like, it gets discouraging because we know we're touching small pieces every day. Like, we know how many kids and families come into contact with the department. We know how many workers and frontline professionals and supervisors and things that are out there that we have not had an opportunity to interact with. But we're making progress. So we started in earnest to work in partnership with DCS in probably mid to late May of last year. So we've had several months where we could just get out and network, first of all, and now they've been doing the work. So at the end of last year, we haven't totaled in what we've had so far this year, but we had done a total of around 214 direct consultations on cases with frontline professionals or supervisors. So, and they will explain more about what that involves, but that's a really intense look at some cases. We have participating in around 70 to 80 pre-custodial child and family team meetings across regions. And those are spaces where they can interact and interject into the case and talk about services and make recommendations and even model some of the discussion and how we want to engage families, ask questions. And then we completed about around 180 trainings and educational opportunities, both within DCS and within the community. So like I said, some of those have been in the courts. Some have been within DCS. We host a couple of trainings each month that way. So they've been able to do a lot of great work, and we're looking forward to continuing that partnership with DCS as we move on.
Thank you, Tracy. That was kind of a 20,000 foot view of what we do. Question, raise your hand if you are West Tennessee. Raise your hand if you are Middle Tennessee. All right, East Tennessee. Anybody statewide? Yeah, you are definitely statewide. How many of y'all cover more than one county? All right, so you are going to get what I'm about to say. County to county, to region, Tennessee is vastly different. Mountain City to Memphis, we've got it all, right? Go like this, pretend like you're listening to me. Fabulous, yeah. So, yeah, it is very different. Even counties that are right next door to each other, even within the same county, the community and the culture are so different. And you're going to hear that today. So I might pick on Caitlin for a minute, and then I might pick on Stephanie for a minute, and they're on opposite sides of the state. So you might, we supposedly do the same thing. We all have the same job description, but it's going to look different from county to county, from region to region. So keep that in mind when we're answering the questions. And I know this is a very intelligent group of people. I can tell by looking at you. You look like you're very intelligent. Liz is shaking her head at me. That is hysterical. So I'm saying that because you have figured out by now that this is a panel discussion. Go like this. See, they're sitting up here. It's a panel. It even says so right there. What are you doing? So yeah, this is a panel discussion. So how this is gonna work is I'm gonna ask a couple of predetermined questions and I'm gonna throw it out. I might pick on some of them because that's something I enjoy doing, to be honest with you. So what I'm saying is to say, you're gonna have questions. And if you do, if you still have your paper from Jeff's fabulous interactive networking cool thing that we just did, go ahead and write those down. We'll put them on the parking lot. And if we've got time allowed, we're gonna grab those at the end, okay? And unless you don't understand something they just said, okay? What is FFPSA? What is Schwartz? That's like that's a thing, you know? Y'all quiz her afterwards. And we'll be around afterwards. If we've got questions that we didn't get to, we'll be around afterwards. And I want you to make sure you grab your person too and say, hey, I'm so-and-so. Okay, so we're gonna get started. Is that clear, Bud? Yeah.
Where's the parking?
Crystal's gonna be my. I'll be the parking lot baby. Just write them down.
Okay.
Just write them down and hold on to them. And then I just don't want you to forget. I'm like, I'll come up with a question during a presentation at 2 a.m. I'll be like, oh, I forgot to ask whatever. So
Just write it and keep it.
just write it and hold on to it. If you do have one, Crystal said she'll come get it because she's pretty accommodating that way. Okay. All right. We're ready to get going. So one of the things Tracy was talking about, and she didn't use the language, but we've got several core responsibilities. She talked about each one of those, that what each of us do. So we're going to go through some of the core responsibilities and I'm going to throw some questions out for them. So the first core responsibility is that you heard Tracy talk about was coaching the direct service professionals within DCS. So some of these questions are going to relate to that. So who would like to tell us about the impact of coaching of direct service professionals has had in shifting that whole child welfare system more towards prevention?
So I'll take that. Something that Tracy mentioned when she was talking at the beginning was a lot of us came from DCS, and I just want to state that us combined is 150 years of experience with DCS. So when we come to this role, when we are working with those frontline professionals with DCS, we remember what it's like, and we know the pressure that they're under, and we know all of their responsibilities. And so with that being said, when we are working with them and shifting that focus to prevention, an example that I really have is when I was on a family team, a CFTM, which is a child family team meeting. We were discussing the situation at hand and talking, and something very simple that I did was just ask a few questions to the family that brought them back to the table. Because the facilitators and the team leaders and the frontline professionals, they got a lot going on and they're trying to gather everything. And so you can see the family re-engage and come back to it. And it was just questions that helped move the process along for DCS to step back in. We don't come in here to trump or to overshadow. We truly come in here to support. And what that also looks like with shifting the focus to prevention is having our one-on-ones with the frontline professionals. And when they're talking to me at hand about like, well, Johnny is just really hitting right now, or, you know, just a situation at hand, I just ask questions of, but if we do this now, what is that going to look like 5 years down the road? What does this service right now look like 5 years later? Because a lot of the times, myself included, when I was at DCS, I was like, well, this isn't an issue right now. We're just working on this issue. But if we have a lens of, well, it's not an issue right now, what would it look like in a couple of years? It's shifting that focus, and those little small impacts really touch. And it's like dropping that stone in the water and that ripple effect that goes out that I see when I see the shift and focus on that.
Thank you. Does anybody want to talk about case consultations? Tracy mentioned case consultations and she mentioned case reviews. So we're going to, in our next section, we're going to kind of differentiate between those. So I promise you, we'll get to that. But how does that provide an opportunity to collaborate with and coach the frontline professionals?
So I can take the one about case consultations.
Okay.
Okay. All right, so case consultation. So if a frontline professional or supervisor in prevention, so that would be CPS or FSS or FCIP.
And those stand for what?
Child Protective Services, Family Support Services, and Family Process Intervention Program. So if they have a case of a family that they have worked with several times, or if they did this family and they see that they've had a lot of history, and they may be wondering, what are we going to do next? What are we gonna do different? What did we miss? So they can reach out to me and ask me to do a case consultation. And what that looks like is I go in and I read the entire family history, every case. And I'm looking at a lot of different things. I'm looking for and pulling out a lot of different things. So one of those is the family story. What has this family been through? What's the child been through? What are their traumas? And I'm making a list. Who are those family supports? Who are those friends that are there at these CFTMs? Who are the relatives that are there? Who's had custody or provided care for this family or been there to support them in some way? And I'm pulling that out. And then I'm looking at what have we tried before? What services have we had before? What services have DCS provided? What services has the family seek? And I'm kind of making a timeline of this is the things that we've tried over the years with the family. And then I'm looking at missed opportunities. Are there things that is maybe in the file that I can kind of get the sense that we've not really addressed that, or it might have been missed, or this new worker 2 or 3 years down the road may not have been able to, pick up on this, hasn't had time to read all this history. So I make a summary of every case that the family's had and kind of a short little summary of what that looks like. And that timeline of services, that list of family supports, the strengths that I identify in the family, the strengths that the former DCS frontline professionals have had and shown in the work that they've done with the family, and those missed opportunities. And I'm writing all this up and I'm giving this to this assigned frontline professional and a supervisor. And I'm giving them all that history and all that support, and then making recommendations. What evidence-based services am I aware of that could really benefit this family? What other resources and services do I see that maybe could be helpful as far as like concrete supports and things like that? And then send them back to the family or to the team.
And what she didn't mention is this takes hours.
Or days.
Days.
When you have 15 past cases, some days.
For sure. And again, those frontline professionals are so busy, they just don't have time to dig into it. And when I do it, I'm not lying, I go through bags of sour gummies. It's just a lot. My cookie skill, not gonna lie. Everybody wants to, in my heart, sour gummies. Thank you, Kristen. Does anybody else want to touch on that?
So in Northeast Tennessee, I love highlighting my team time I get the opportunity. We are very lucky in Northeast Tennessee to have wonderful specialized teams who do great work. And so when I'm collaborating with those professionals, I'm doing the exact same thing that Kristen mentioned, doing those really in-depth case reviews, doing service recommendations, strengths, missed opportunities. But I tend to go a little more specialized in what the family needs. Like in Northeast, we do have our domestic violence team, and they did a wonderful presentation this morning, as well as their safe baby court. So sometimes those services can look like, hey, we have a mom in safe baby court. She needs parenting classes in Spanish. Can you help track that down? So really going out into the community and trying to find those people who can support our specialized teams.
Whoops, you caught me. Thank you. And again, we talked earlier about how it's different from county to county, to region. So is there anybody else that has different key coaching opportunities in your region? Again, we just went from Northeast to Memphis. So just keep that in mind when you're listening.
And so, for me in Shelby County.
Hold it closer, sweet one.
For me in Shelby County, in June, it'll be my 38th year child, whatever Most of those, all of those years pretty much have been in foster care. And so, we know that foster care is the last resort. And so being able to work on the end of prevention, I was trying to figure out how can I get in on the front end and work with our families to prevent them from coming into custody. And so I had this great idea in my mind to do the pre-custodial child and family team. Well, I probably bit off more than I could chew initially because my calendar would be so full. They would send me the invites, and so I would attend the child and family team meetings because I felt like this was a place for me to hear the family's voice. And so what we've heard during this conference is nothing about me without me. And I always feel like that if we could hear the family's voice and we could listen to their story, as Christian has said, then we could better be able to identify some resources or things that they feel like they could work on. So that's what I did. I started attending the child and family team meeting, pre-custodial child and family team meeting, because at that point, that gives us the opportunity for everybody that cares about the team to be a part of that team. And so, for me coming to the table and I've been, I think, in this role since January of 2024, so I've had the opportunity to identify a whole lot of resources within the community. And so what I did is I would try to, if I get proper notice prior to the child and family team meeting, I would read a little bit of the case history, as they say, do a kind of extensive deep dive. So when I come to the table, that I would have some ideas in mind or some resources in mind that would meet the needs of the family. And so, and sometimes during the child and family team, I would be texting the supervisor and say, ask about this, or the caseworker and tell them to ask about that, because we would have providers that may have called the referral in that had resources available at their agency or hospital, and they were not telling the family about them. And so I would, send them the website and say, look, see, they got this on it. And so it just gave me an opportunity to be on the front end, identify evidence-based services or services that will meet that family's need, as well as sometimes ask those difficult questions where to dad, did they contact the dad and bring them to the table and let them know that there's the other side that, you just don't always have to look at the maternal side, look at the paternal side and bring them to the table as well. And so also, which led me to getting more consultation with the FAST reviews, helping them to understand some of the ratings and the items and the need for them to do quality FAST, because we know that if you do a quality assessment, you can more than likely end up with quality services. And so that's what has helped me to kind of get my foot in the door in Shelby County, to work with the staff and for them to rely on me to be that resource for them, not to take the place of resource linkage, because I share all my resources with our resource linkage person, so that they can have it as well in their time of need for that family and their work.
Stephanie, that is a fabulous segue to my next question. We didn't plan that actually. And I've heard several of y'all talk about those resources that, we work alongside with resource linkage a lot across the state. But what do some of those case reviews look like as far as service recommendations, resources, that kind of stuff? And again, as y'all know, it's different from county to county, region to region. So what have y'all seen as far as service recommendations and resources in your area?
So, while we do the deep dives, which are very time consuming, as we've made out, sometimes a DCS professional may call or send us an email to say, hey, I've got a 17-and-a-half-year-old that is fixing to turn 18. He's going to be homeless. What have you got in him? And then I'm like, okay, well, I met the Homeless Coalition at a networking meeting. Let me find their business card and let's contact them together and get that. So part of our work is sometimes we have to give those quick resources, reminding DCS professionals whose brains are already full of crises and fires that they're putting out, that, hey, we have those child welfare and domestic violence liaisons that we can tap into. Absolutely. We have I have my local Nikki here too as well. Give her a little shout out. So it's finding those quick connections as well. And we're all very well versed in what our counties have in either evidence-based services or programs or local resources. As we know, little old Northwest Tennessee, Lake County does not have the same over here as Knox County, like nowhere near. If anybody's ever been to Lake County, you know what I'm talking about. Rosa Lake, yes. So it's finding those small little pockets of resources and letting those DCS professionals know, hey, I've got your back. I've already looked into this. Let me make sure that there's no wait list, and this is what we can get. And if we can't get, you know, the evidence-based program, then we're gonna get the next best thing. It might be a little bit lower tier, but we know that not all counties are equal here in Tennessee. So that's a big part, and, you know, capitalizing on that, I had an FSS, Family Support Services team leader, contact me that one of the local courts had called him and said, hey, I've got Hispanic family, they don't speak any English, and they're gonna come in on, the child is gonna come in on a unruly charge. What have you got in your back pocket? And I'm like, okay, well, this is what we can connect. They've got services that can help with the Hispanic population and get those resources to meet the family's culture and needs. So that's a big part of us. And like Stephanie said, we're not here to replace, we are here to support and be in their back pocket as that guide to say, hey, we've got you. And we know about these services, we've called, we've networked with these people at local meetings. So we're very proud of that and to be a support to DCS, because a lot of us are from DCS. And we love our colleagues at DCS. And we want to be that fresh of breath air for them.
I got that, Jill.
Perfect,
Stella, thank you.
I'm gonna add just a little bit. So another thing, they mentioned working, partnering with resource linkage, personnel within, DCS. We also do a lot of collaboration, and we're starting to build more of that connection within, like with the court liaisons who work within DCS. So now we're starting to get some ground there for them to, recommend calling for like CFTMs, or if there's a specific request when a family's getting ready to go into court. Some of the consultants have had the opportunity to go sit in on court or go with court liaisons when families are coming in, or just to do some consultation like in real time at the court before the families are going in. They're getting updates, the liaisons are getting updates on family status and what's happening. And they're able to say, wait a minute, you know, we've got this other service, we can try this service. Let's see if, you know, if they will let us attempt this before we have a discussion about custody. So we're not just touching the frontline professionals in the work that we're doing. Like, we are really trying to connect with any component within DCS. And how do we start to make headway in changing that culture? Vanessa had to step out for just a second, but I do want to share some of the work that she has been able to do. She's our Mid-Cumberland, our old Mid-Cumberland region, but she works in that area, and she has really been able, it kind of highlights the difference where you heard Stephanie talk about she's gotten in through CFTMs, and Caitlin has gotten in through a specialized team within Northeast. Vanessa had kind of a different opportunity within the Mid-Cumberland area. So they really embraced her as she came into that region to offer support. So Rutherford County utilized her a lot for services, consults, Wilson County, Wilson, Trousdale, in that area. And then she kept working away, and now she's really starting to kind of unfold some work in Montgomery County. And they're in the back. So, but we were talking about specific needs for services, and that's why I wanted to kind of talk about what she was able to do. So we have the DV liaison program that's across the state. Montgomery doesn't have a dedicated DV liaison. And they were having a high number of cases just for the proximity a lot of times to the base and different things there. So she was able to come in and understand what their need was there in Montgomery County. Like, what are the needs that you have right now that I can help you with? So she helped develop through the networking that she had done, kind of pull together a a GV manual as such for that team. She connected with some other GV liaisons across the state. She talked to them about what's in your, what do y'all have? What are your resources? What's in your guides? And she researched, she worked with the sheriff's department there to talk with them, you know, just about what they're seeing, and we got in contact within the sheriff's department that would work, you know, alongside DCS in that capacity. So we're not just touching on the front line, like as we're out, as every one of them are out in their regions, it's really about what specifically do you need and what can we help you with and what's going to help us prevent children from coming into care in whatever space that looks like. We do, I know every one of them do their dead level best to find resources. We had a judge at a provider forum back in December that they're starting in the South Central region of court, and he was looking for resources, and Shauna was out, you know, just combing through everything she could find to identify resources for them so that they could go back as a team, but then as they're getting ready to roll that out and talk about services that were available and what they could use. So just that identifying services piece has been a huge component for the team.
Thank you. And we're going to talk a little bit more about that piece of it, that networking and things. Does anybody have any burning questions about the coaching and case dives and all that stuff before we get moving on? Yes.
How long does it take for the turnaround or the recommendations to come from the deep dive?
That is an excellent question. I'm going to take this one and say it just really depends. Because by the time it gets to us, we could have 14, I think one of mine was 25.
I've had
37 past referrals to DCS. So that, again, it could take us a week to dig through that, get that history down, that family tree down, that kind of stuff.
Is it like a referral type? Or do I just,
It's a deep dive into the case to get that past history, maybe that family tree, that kind of stuff, whatever, and then connecting what we've seen to some resources. Kristen, did you want to say something?
Were you asking how you would access
yeah,
that?
do I,
So
is it
call
like-
her or email your
Okay.
prevention consultant
Yeah.
for your region. That's all it takes. And then just give her that case number. She might want to talk to you briefly about what's going on. It's a couple-minute conversation, but even just a case number and say, I need this, we'll get started.
Yeah.
And I was just gonna add to that, Jill, Kristen, they don't all take that much time.
Yeah.
We try- and we have done some in-depth ones. I've had one that had 9 children. And years back to when the mother was a child. So it is a lot to comb through. But typically we're trying to turn them out within a couple of days, if that. I mean, I've had somewhere 24 hours, I've come back and said, hey guys, these are my recommendations, and just capitalizing on the great work that they've already done. And that they just don't have time to read and thumb through all of that stuff. And, you know, it might be that 5 years ago, there was Uncle Johnny and Aunt Sue, and we could say, hey, 5 years ago, there was an Aunt Sue and Uncle Johnny. Any idea where they might be, if they're still around, you know? So it can be pretty quick, but yeah, just a simple email, call, text, and we'll be on it.
I just want to just communicate with your consultant. If you're like, hey, we have a meeting by Friday, can you gather this for me and things like that? We can work with that, but understand that the time with it is part of the quality that we bring to the table. And so as much as we want to turn and burn it for you because we know how fast your world is, know that the time that we take is the quality that we're bringing to you so that we can really serve those families for you to serve the families that you're working with.
And I just want to add to, like, tagging back on to what Stephanie had shared about the CFTM. So sometimes her participation just in that child and family team meeting leads her or others as they participated to then go back and go, it would be a good idea if we look back at this history. Like, we might not have been able to do it before the meeting, like if we learned today this child's going to come in, but that's something that any of them do after. Like if they need to go back through and really dig into that case to learn more before we come back together again, we're gonna do that. And do that alongside the work. Like it's never, like I said, we're just there to support. We're really trying to support.
And I'm gonna add this too, because if you have that many referrals, then you know that there's some underlying issues that we have not really identified. And so just going back and looking at the history kind of helps piece that puzzle together. And so that's why I like reviewing cases, and so I do it a lot. Just to see, where they've been and where they're going.
Yes.
Now, first I want to shout out to the West Tennessee FFPSA. I can't believe y'all don't have this one before me though. Another flag is some DCS people in here, because I was wondering why y'all wasn't up there. I can't believe she don't have, what I'm talking about. Give me the jab. I used to work with her. Give me the jab.
That's fair. Well, great conversation. Thank you guys so much. We're gonna move on to our next core responsibility, and that is building community partnerships. So we do a lot of work around engaging different agencies in our region and our community. So who would like to talk to us about the importance of building those community partnerships? Why is that important? Going to these meetings important for families?
I can touch a little bit on some of that. So something unique to east side of Tennessee is,
Sorry, we're having a sidebar.
okay, all right. Something unique to the east side of Tennessee is that there are these collaboratives that meet quarterly called ECAM and SMICAM, which means I saw it, I was getting there. The SMICAM is the Smoking Mountain Interagency Community Meeting, or the East Community Agency Meeting. And so those are quarterly, where a lot of providers come together and collaborate and talk, and we have presenters, and it's really just a great time to network. And I was really grateful to get the opportunity to take over that when I got into this role. I did not start SMICAM, but I got to take it on and take it forward. And something that me and Jill do this side of the state do is bring DCS to the table. Because a lot of the times DCS was not coming to those meetings, and like the people that need to be there is DCS. And so we've really been working hard to get our resource linkage there, and also our team leaders, but not only the team leaders, the case managers, the frontline professionals who are sitting there with the families doing the work. Because I think Peter talked about it in his opening address yesterday. While directors are great and they have a certain role to play, the team leaders and the frontline professionals, you guys are doing the work day in and day out and meeting with those families. So getting that community involvement to their level is how we're going to work with these families and how we're going to implement the services that's needed for them.
So, in my little area of Northeast Tennessee, we have a lot of very, very isolated and rural counties, and we also have cities that are a little more well-versed in some nonprofits and resources that are out there. So in my community, we have a wonderful resource linkage professionals who's worked really hard to get community advisory boards and things up and running in our area, which is just a meeting where different agencies come together to see how they can support families within DCS. And so we're looking at networking and getting that up and running in a region again. And we are also looking at forming a community alliance for prevention for East Tennessee, where we get together both formal and informal supports, because we're very aware of a lot of the formal supports in our area, like nonprofits and things. I think, a lot of nonprofits do a great job of getting the word out there about their services and the things that they can offer. But especially in our really rural areas, we're trying to bring together individuals, faith-based community churches, people that we know are there willing to help our frontline professionals and our families but they are always interconnected. So really looking at filling that gap.
I know Vanessa was gonna talk, and she stepped out for just a minute, about the community advisory board, the local CABs. That is legislatively mandated across the state. And sometimes it happens and it rocks, and sometimes it's not so much. Don't you love it when legislation says you have to do this, but no money to do it with? So even if they give us money for donuts, I think it would be better. So, some of them were really rocking it. And what a CAB does, or what the Community Advisory Board does, it's really there to support DCS and all the work that they do. They can bring cases to review, even if there's an email list. If there's a resource that's needed, they can send that out to the CAB, between meetings or whatever. So it's really there to support DCS in the cases and the work that they do in the community. But it's also a great time for us, as to get to know the nonprofits that are in the area, the churches that are supportive. COVID did a number on some of ours in the East, for sure. I get to see Liz at some of them. Some of them are great, and it's in person, or it's a hybrid now. Sometimes it's just Liz and I sitting there with the computer, and that's okay too, because we're the fun ones. And then sometimes some of them are in person. Very few are in person anymore, but now with the restructure and working alongside our resource linkage people, we're either trying to get them built back up or even started. So that's part of what we get to do too. We get to work alongside those.
Okay. So I have a couple of state aid reports in my region, and one of them I have engaged with that state aid report coordinator, with the DCS state aid report staff, and with the DCS legal, met with the magistrate for the court. And I suggested that we do like a monthly case staffing of those state aid court cases. I'm trying to pull in service providers and resources. We're talking about the cases, kind of what the status of the case is, what services are needed, and what the barriers are to the services. And we're trying to do that every month before we go to court, so that we can make sure that we're progressing. And I'm just trying to be that additional resource linkage support for the state aid court coordinator staff.
How many of y'all go to like a local PAB or interagency meeting? All right, raise your hand if you don't. All right, go. If you don't have one, talk to your resource linkage person. I'm not even making this. I'm actually making this up completely as I'm standing here. But reach out to your resource linkage person and say, where's our CAB? And if we don't have one, how can I help you get it started? I mean, that'll go a long way of building those relationships, for sure. Are you?
I just have to say, like, if I didn't go to CAB, maybe I would have never met Jill and Kat.
And what a shame that would be, y'all, for sure, for sure.
And I just want to say to you, in your welcome folder that we got, that was handed out, there's a map in there that has the contact information for my whole team. So it has their email, their phone numbers. So you can always reach out to who serves. It's broken down by county, so you can see who serves where you are, and they can also help you.
We'll help you find the CAB. If you're in my region, don't call me. I'm not making up. I don't know your number. I'm not gonna, because you're gonna try to give me, an extended warranty. So I'm not gonna answer the phone, but please shoot me an email and I will get right back to you. Y'all are laughing. It's true. How many of y'all answer a number you don't know? You two are not okay. All right. Y'all are not okay. Y'all should get together and talk. Okay. Questions, comments, that remarks so far? Any other? Yes.
I just real quick wanted to say that I think I'm west, Midwest, Southwest, the whole Eastern.
Yes. You have like 400 counties.
But there are a lot of DCS people in our area that are not familiar with what CAB is. There are counties where we at one time had them, they no longer do.
Right.
We do have prevention coalitions, and so I think they're probably taking the place of one of that. I don't know.
You're not absolutely wrong. And then some of us have, I think, health councils that they've merged. Again, COVID did a number on some of the CABs. you're not wrong. We see it happening, and we're going to look at that as an opportunity for improvement. How can we get this CAPS? I mean, we really want to support the DCS frontline professionals. I see you over there, loved one. I see you. Yes.
I will say, that's one of those thorns in my side. If there was something y'all wanted to work on, combine the CAPS, the health coalitions, the anti-drug coalition, the health council. You look at the same person every day at the same time.
And I was
Ain't nobody got the time to do that, and y'all waiting to come to school.
Exactly.
Y'all give them FFPSA speech to fix that.
Well, sorry, that was one of the things that I was going to talk about as well. We know through the restructure that's just happened, so some of you were in the session this morning where Mary Beth was there. So as part of that restructure within DCS, there is a prevention arm of work, and the CABs, the court liaison, and the kinship and a relative caregiver are going to be managed over there. And one of the first things that our team alongside our implementation team has worked on is to give some feedback to DCS around where are CABs functioning, where are CABs not working, and really for them to start to look at how do we revitalize and how do we reshape what the community advisory board looks like. So we are very hopeful that we are on the right path in partnering with them to kind of reshape that and streamline some of those meetings.
You know what we need is, all jokes aside, CABs come out of DCS. What department do anti-drug? You know, the state department.
Mental health.
Who does, health council? No, state department. We need somebody to sit at the table with the state of Tennessee. It says that there are only so many people in each county. Right. We only have so many state people in each county. Who all of these state agencies and departments in Nashville are asking these same people to sit at their table.
Yes, I agree. Yes,
We need somebody to sit at the table with the state to bring us all together.
I think the word you're looking for is collaboration.
No, we don't collaborate, that's why we got separate.
Consolidation.
Consolidate. Collaborate is what brought it.
Darrell,
That's
raise
not
your,
what we
Darrell, raise your hand. Darrell?
Oh, did I? No.
I'm not calling on you. I don't want you to talk.
Yeah, but talk to
Right,
Supervisor.
What I want everybody to know is who Darrell is, and if you have more CAB related questions, she is the goddess.
Oh, I'm
So, because we need to wrap this little piece up. Did you have one more question? Okay. I mean, we can talk about this all day. I mean, I've got nowhere to go, but.
Well, I just want to say that Montgomery County,
Yes.
our CAB and all of our organizations, we combine together. So CAB in Montgomery County is very alive. We always serve lunch to all the providers that comes in there and we rotate. We combine all of the organizations in one thing. And we go to different agency where we had our meetings every fourth Thursday of the month. I would like to invite you guys to join us so that you can see how we handle Montgomery County.
Okay.
Yeah, that's right there.
And the only thing I was just gonna ask that would respond over to you.
And I'm a big fan of Feed the They Will Come.
I was just gonna respond when I did raise my hand, just to say, there is a statewide prevention collaborative that includes DCS, Department of Health, Department of Mental Health and Substance Abuse, all the people. And so this is something sort of this, how do we bring these different groups together that around to their shared agenda, right? Rather than having the same people meet 3 different times, right? Surely there's a way to do that more efficiently and maintain a level of effectiveness. Because each group is gonna say, well, we have our own issues that are specific to health and have nothing to do with DCS. And DCS is gonna say, well, we have things that are not, fine, let's fragment the agenda, right? We can do that. So that would be one thing. The prevention, that's a great thing, I think, for the prevention collaborative to talk about. The other thing is, though, that I just want to remind everyone that a community advisory board should not just include the people, the state departments, the formal services. It's about the informal services and businesses in the community as well, and faith-based organizations. So again, we're looking at a somewhat different composition. So, yeah. So those are all things that we are absolutely, not we, but the department I know is thinking about. I am definitely not the goddess. So.
Yeah.
Then you've got like
This is the
15
parents
minutes.
of
If it's
the
three
government. We have the mayor, we have nonprofit, we have the church.
Yes.
We have the parents, we have the parents. We have everyone. I would like to invite them. And for me, we will also get awareness of that, like what was invited to public awareness.
Right, and she'll be available at your
I need to get your
Yes,
contact
ma'am.
info.
Yes.
I need to talk to you.
And she's going to, tell me your name,
And Maureen, the name, run the town, the government.
what she said, she's gonna be here. Sorry, that's a lot of words.
I run the town.
She's gonna be in the back afterwards. She's gonna be in the back afterwards.
You make a change.
All right, no, we've got one more question to go through, and then we can either pick up the discussion or find another one. This is great information, so thank you. So the last core responsibility that my team has is around training. Tracy mentioned that earlier. So Tracy, if you want to give us like a 32-second snapshot of why we do the trainings that we do, like the history.
32 seconds.
Go.
I think I touched on it when we started, but part of that lies with, as we went through child and family service reviews, with DCS, within DCS, part of the focus group discussions, part of the findings through that review process is just the, I don't want to say it's a lack of information, but it's not a lack of information due, I don't feel necessarily to, nobody wants to have the information. It's just like we mentioned earlier, it's the time and the resources. So part of what we were asked to do is how can we, within Schwartz, how can we bring that training an educational component into DCS to help DCS frontline professionals and supervisors understand what evidence-based services are, why are evidence-based services important, and what is the purpose for shifting this focus toward prevention.
Thank you. 32 seconds. I think she was there. I think she was perfect. I'm going to pick on Christina. I skipped her earlier. She had some really good information about case review. So if you want to hear more about that, see her afterwards. Raise your hand, Christina. This is Christina. And she's going to talk to us a little bit about training.
So yes, we offer training 2 times a month to DCS, and those professionals get those opportunities to hear more about prevention. So we do a specific one once a month on the spotlight for prevention, where we emphasize our evidence-based programs that we are contracted with throughout the state. And we're really trying to connect those resources to those staff people. So the more knowledge that they have about what services are available that are evidence-based, because we know those are the most effective in our work with families. So we really want to encourage those programs and services. So we will highlight those. So those have been parent-child interaction therapy. And also, we'll have one coming up on it. And we've done one already that's on our website. All these trainings are available on our website too, if you want to go back and listen to any of them. We've also highlighted our intercept program and multi-systemic therapy through youth villages. So those are two also that we use a lot. And hopefully the other ones that we do during the month, we've done a lot on protective factors, those building those resiliency skills and social supports, natural supports, knowledge of child development, parenting practices, all of those to help connect the FAST as well to those services. So
What's a fast, Christina?
the FAST is the Family Advocacy Support Tool, and that is an assessment that DCS uses when they are working with a family. And they complete that in several areas, and we really want to make sure that there is an identified need from that assessment, and that is linked to a service. It's very important that we are identifying what those needs are for families and connecting them to those services, those evidence-based services, or whatever services they might need. And then we also are doing training on ACEs and the positive childhood experiences, and then other programs across the state, like Caring Dads, and then Safe at Home, school collaboration. There's been a lot that we've done, and then Kat is going to talk about regional training.
Before Pat does that, we're gonna pull up our website. And while we're doing that, I want to highlight Crystal Cooper, Dr. Crystal Cooper, who is the brains behind our beauty.
The parking lot, yeah.
Or she might be the beauty behind our brains, I'm not sure which, but she is the motivation, whether we want her to be or not some days.
I mean,
getting our training going, up and running, and keeping us on track, and we love her for that most days. All right, so this is this is not our website. Just kidding. So this is our website, FFPSA. And if you scroll down and down, there's upcoming trainings, but here's our recorded trainings right there. I'm a big fan of the 5 protective factors because that's one of them I did.
That one, that is exactly one.
I did that one for sure.
That's
but we've got some really great trainings in there, so check it out. All right, Pat, sorry, go ahead.
So, like we talked about, Northeast all the way over to Memphis, the area is different. So I have the lower Northeast, which is the new area, but 2 counties in that area is Hamlin County and Sevier County. So if you're familiar with this side of the state, there is a very big population of Hispanic culture in those counties. And so something that I did specific to those counties was I brought in local leaders in those cultures that are running nonprofits or that are doing community meetings already with them, and brought them in and to provide education and training to the DCF professionals in that community that are working with those families in that county. And, Sevier County and Hamlin County are really just like one county apart on the map. But those 2 counties have just big different culture diversity. And so for Sevier County, a lot of these families are coming from Guatemala, and these families don't value education after 5th grade. Well, we're seeing a lot of intakes with, educational neglect. So the professionals in these areas are coming in and explaining that it's hard for parents to understand the value in the Tennessee state law of education because they didn't have that for them where they're growing up and where they came from. And it's very simple communication and just learning and understanding, but it was really encouraging to watch the frontline professionals like eyes light up and like connect the dots and help bridge that community connection because they were able to lead those sessions knowing how better to work with the families that are already on their caseloads and working with them and helping them. And so I think that's something that training is helpful all the way around, but what's really awesome about our roles is that we get to go specifically to our areas and do those trainings and really help the populations that are there because those are the families of Tennessee and those are who we're serving.
We are close to our time. We have like 10 minutes left. So any additional comments from any of our panel members or our teammates in the front? Any burning questions?
I just wanted to come back. We didn't get an opportunity. She talked about the reviews, but one of the things that we do as a team is we do a lot of targeted reviews. So we work very closely with the implementation side of our team. So we get in there and we can look at the case details and we're able to give information back across to them on what we're seeing day to day or month to month in practice and what's happening out there in the field around evidence-based services. So we've done some very targeted reviews around how we're accessing home builders services or how we're accessing or not accessing PCIT. Like, do we have population and services that we can target in those areas based on some of the data that we are able to generate? I know that's one thing that Mildred brought up, and I love her because I've worked with her forever, and I know how she loves data. But one of the things that we know now is that, like, this is early on in this work, even though we've all worked in child welfare for a very long time. We're not gathering all of the information. We're not gathering all of the data that we need to address where we have strengths, where do we have those opportunities in the work around prevention. So part of the role that this team takes on, in addition to the work that they're doing with the frontline professionals, is trying to dig in on those cases and really get an understanding so that we know we can go back into our partners with DCS and say, here's the types of data that we need. Like, we're missing this. There's a big gap of information. So that's part of the work that we do in this space as well. The other thing, while on the side, we're also like helping to really develop tools for DCS that make things easy for them and quick for them, where before we might have had resource guides where we have to come, we're out talking with the family and we learn about all these needs, and then we have to come back to the office and we have to look things up and look for phone numbers or look for resource guides. We have worked to develop flyers around PCIT so that there's QR codes on there and they can hand that to the family. The family can click on that QR code. They can look at a quick little video about here's what PCIT is, and that takes some of that stress off of that frontline professional. We also have a code where they can quickly scan and look for where are those resources. So they can do that when they're in the field. They're on their phone. They can sit with that family. They can identify the service, and they can quickly look that up and get that family connected right then and there, like without having to wait. So we're also in the process of developing a bench card for our judges, specifically in our 3 counties, our PIP counties with DCS, Davidson, Hamilton, and Washington.
What does PIP stand for?
So it's the performance improvement plan that DCS will have as part of round 4 of CFSR.
What's CFSR?
I've already said that. You're not listening to child protection service review. But we're to give them a knowledge so that they can quickly look at, here's what PCIT is, here's the ages that it serves, so that when families come into court, they can quickly see what are the evidence-based services. So we're working on that, and then we're getting ready to launch a directory, which we talked about in the program that our implementation team did. But our team informed that directory. So we gathered the resources, we learned about what's out there in the communities, and fed that information over to the implementation side. So we do have the 2 arms of our grant and the work that we're doing, but we work very closely together in this work around how do we move prevention forward in Tennessee.
All right. Thank you. Thank you. I think that's about all of our time, but we, like from 3:30 to, I'm going to say 5:30, we have a break. We will stay in here. If you've got burning questions, comments, snide marks, we are open to anything. It's totally cool. So thank you guys for your time. We appreciate you very, very, very much.